My name is Melina, and I have done my presentation on ALS, amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. ALS is a rare progressive neurodegenerative disease that affects upper and lower motor neurons responsible for controlling voluntary muscle movements. Key features of the disease are muscle atrophy, weakness, and fasciculations of the muscle. Currently, there is no cure for ALS, and the disease process remains idiopathic. Here I have included a diagram comparing a healthy individual and an individual with ALS. As you can see, ALS manifests with muscle atrophy, damage to the myelin sheath, degeneration of a neuron, and a weak connection between axon and muscle fibers, leading to blocked signals from the neuron. There are 1 to 2 per 100,000 people diagnosed with ALS yearly, with a mean diagnosis between age 55 and 75. Of recent, ALS has been seen more frequently at younger ages. Men have a slightly higher chance of having ALS than women, and currently there are 450,000 people living in the world with ALS. The exact cause of ALS is largely unknown. Theories point to genetic mutations, protein aggregation, and chemical imbalances such as increased glutamate and calcium within the cell. These particular mutations have presented in many participants of case studies. First, a mutation of the SOD1 gene. Superoxide dismutase 1 gene causes exposure of the cell to reactive oxygen species, causing neuronal degeneration. The TAR DNA binding protein mutation interferes with RNA metabolism, causing neuronal degeneration. Fusion and sarcoma mutations are affiliated with loss of primary upper and lower motor neurons, and angiotensin and optineurin are coding proteins, and their mutations have been identified in ALS cases. However, the cause is unknown. Glutamate is the most abundant neurotransmitter in your brain. In ALS, there's excess glutamate levels in the brain. This toxicity is due to calcium flooding the cell, causing neuronal damage, resulting in neurotoxicity and paralysis of the muscles. The anterior horn cells in the brain atrophy, along with damage to the motor cortex. In turn, motor neurons are replaced with astrocytes that harden the spinal cord and causes degeneration of peripheral nerves and neurons. What is so devastating about this disease is usually patients with ALS are fully aware of what's happening. Their cognitive functioning is still preserved. There are 2 types of theorized ALS. 90% of cases are sporadic, meaning idiopathic and unknown why it occurs. The other 10% of ALS is believed to be inherited via the genetic mutations that were just discussed. Early signs of ALS present as muscle weakness, difficulty walking, muscle wasting. Progressive signs manifest as fasciculations, fatigue, slurred speech, trouble swallowing, and pseudobulbar effect, which is continuous laughing or crying. Late signs manifest as paralysis of voluntary muscles, contractures, and end stage ALS is respiratory failure and inevitably death. There is no definitive testing to diagnose ALS. However, providers use these certain tests to rule out other conditions. They do this by electromyography, MRI, nerve conduction tests, blood and urine test, conducting a biopsy, medical history, a physical exam, and tracking symptom progression. There's also diagnostic criteria to make a definitive diagnostic decision in a person having ALS. So definitive diagnosis results in motor neuron damage in 3 to 4 regions of the body with progression. Probable diagnosis is motor neuron damage in 2 regions with progression. A possible diagnosis is motor neuron damage in 1 region without any progression. And an unlikely diagnosis of ALS is anyone who presents with cognitive, sensory, visual decline without any signs of progression. Risk factors include risks in the environment, such as radiation, as well as chemicals such as pesticides, fertilizers, herbicides, insecticides, lead exposure, and formaldehyde. Genetic mutations are risk factors, and lifestyle. Dieting, if you have a low BMI, you are more inclined to be diagnosed with ALS. And ironically, if you exercise excessively, you're at an increased risk for ALS, as well as if you smoke and if you have started smoking at a younger age. Pharmacological treatment for ALS focuses on Riluzole. It is a medication that slows the progression of ALS. It does not cure it. It reduces the release of glutamate from neurons, thus protecting motor neurons from excitotoxicity and deterioration. Baclofen and diazepam are used to reduce spasticity and muscle spasms. Palliative care is a key factor, providing emotional and spiritual support and relaxation techniques such as meditation. There are many rehabilitation therapies such as physical therapy, speech, whirlpool, heat therapy, and nutritional counseling. And it is very important to focus on the quality of the patient's life, so helping them ambulate, such as using a wheelchair, or helping them communicate, which is teaching them how to use a voice bank. Okay, so the life expectancy for ALS is 2 to 5 years after they've been diagnosed. Relvio, which is similar to Riluzole, it's a medication, comes in a 28-day pack. It costs $12,500 for one prescription, and the extended survival time is a mere 5 months, to put this in perspective of the treatment with ALS and how frustrating it can be for these individuals. Now, this is a famous face that we all know, Stephen Hawking. He lived with ALS for 55 years, as he was diagnosed at 21 years old. He is believed to have lived so long, considering the medical staff that was, around him at all times, and the financial stability, as well as maybe he had a mutation that was just slower progression of the disease. These are my references, and this concludes my presentation of ALS.